This is a 7-minute presentation titled Promoting Healthier Food Choices Among Children, an Innovative Strategy Combining School and Home Gardens. My name is Pepijn Schreinemachers, and I did this work together with 7 co-authors shown on this slide, and we are coming from 4 organizations also shown here. The research is part of the Drivers of Food Choice program. The basic question that this research deals with is, do school garden interventions contribute to healthier eating among children in low-income countries? School gardens are an educational tool, and this means that the purpose of school gardens is to raise children's awareness, their interest and their knowledge about fruit and vegetables, rather than producing large amounts of fruit and vegetables within the school. School gardens are usually not large enough to feed hundreds of children. But by raising their interest and their knowledge, it is expected that this will translate to different food behavior within their homes and within the communities. Now, within the reviewing the evidence for school gardens on nutritional outcomes, there appears to be a quite strong evidence that school gardens improve awareness, children's knowledge and preferences for fruit and vegetables. But there is a lack of evidence, or you can say very weak evidence, that school gardens actually lead to increased consumption of healthier foods. So this is the missing link. Our previous studies in this area show that there are 2 possible explanations for this missing link. First of all, healthier food items are often unavailable within children's homes. Secondly, children are not always the ones making the food choices, but rather their caregivers are making the choices. That led us to the hypothesis, so what would school gardens affect children's food choices if vegetables were more available and parents had greater incentives to serve them? We tested this idea in a pilot in Nepal, in Sindhupalchok district, and established school gardens in 15 schools. Complementary to that, we provided for all the parents in these schools, we provided home garden training, including like garden training and nutrition training to 450 parents. And we implemented this in 2018-2019 school year. The school gardens followed a 23-week curriculum that taught children about gardening topics, but also about nutrition. The schools were provided with basic inputs, including seeds and soil improvements, nursery as you see on this photo. And then the parents were provided also with seeds and the same kind of training in home gardening and also nutrition. And the parents focused mostly on the mothers. Children were encouraged to help their parents in their home garden, and the parents were encouraged to help to also establish the school garden. We used a randomized controlled trial design in which we started with 52 eligible schools, from which we selected 30 schools. Then we randomly allocated them to 2 treatment groups, a treatment group of like 15 schools that received the school and home gardens, and a control group of 15 schools that did not receive the school and home gardens within the project period, but received it after the project had completed. Our measurement focused on food and nutrition knowledge, food preferences, and we collected monthly food choices from both children, from the children and from the parents only at the baseline and end line. The period between baseline and end line was exactly 1 year, same month, so we excluded any seasonal variations. Coming to the findings, our results show that the food and nutritional knowledge, we saw a 26% improvement over mean baseline levels for parents, but we did not find a significant effect for children. We did, however, find that the children's liking for vegetables increased by 6%, and for the parents it increased by 10%. The main outcome indicator is the proportion of meals eaten that included at least 1 vegetable. Now, in the baseline in June, and as well as in July and September, before the intervention was implemented, we don't find a significant difference between the control and treatment groups. However, when the intervention was implemented starting from October, for every quarter, October to December, January to March, and April to June, we do find significant improvements, although it's not always the same. It varies between 15% and a 26% improvement in the percentage of children had included vegetables as part of their meal. What this shows? What this shows is that the importance of comprehensive intervention designs. So it may be that school gardens implemented as a standalone intervention are not as effective than when they are implemented as a comprehensive intervention that also deals with healthier food choices, not at the individual level, but also at the household or community level. So the complementarity of like school gardens and home gardens may be very important. And school gardens in low-income countries must not only try to influence children's food preferences and food behavior, but it may be equally important to make healthy food choices, healthy foods more available in children's homes, and also to nudge parents towards healthier food choices. Last but not least, I would like to mention that this program was part of the Drivers of Food Choice program led by the University of South Carolina, Arnold School of Public Health. And the research was supported by two funders, UK Aid and the Bill and Melinda Gates Foundation. Thank you very much for your attention.